Hello everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So in today's video, I will be covering your evaluation station for NMC OSCE exam. I've already done videos on assessment station, implementation planning, overview of the OSCE exam. So if you haven't watched those videos, please go ahead and watch those first. I have added the link for those videos to the description of this video below. So let's talk about evaluation. So what is evaluation? So evaluation is a verbal handover station of your patient. So it's the same patient you have met in assessment, and then you did their vitals, you did the A to E assessment, and then you had the same patient in implementation to give drugs, and then you wrote some care plans about the patient care in your planning station for the same patient. Now you're going to summarize all those three stations in this evaluation station and hand over your patient to a doctor. Okay, so they ask you to hand over to your patient to a doctor verbally because you're concerned about your patient, and your assessor will be acting up as the doctor. Okay, so 8 minutes verbal handover. You're allowed to make some notes, even though those notes are not marked by your assessor, but it's really important that you take time to make your notes, because without that it will be very difficult to remember everything from last three stations to hand over your patient. Okay, and the method you need to use to hand over is a systematic way, which we call SBAR. Okay, so we're going to talk about SBAR in a second more. So let's first think about what paperwork you're going to get to do this station. So you will be given an evaluation template, which will have a box with the patient scenario and also will tell you what is patient present condition. Okay, so normally they tell you that your patient has deteriorated, their clinical conditions has deteriorated, and they give you new set of vitals to use in this station. So you need to make note of that. And also on the right hand side you can see of your screen that it gives you a headings S, B, A and R. So you can actually add your notes to these headings clearly and then use these notes to hand over your patient. Okay, next, what is SBAR? So SBAR is a very systematic, effective way to escalate a clinical condition which need urgent attention or an effective feedback. Okay, effective handover. So it's a really systematic way. So if you use SBAR, you stay on the point. Okay, and you give the information at only essential information in a very timely manner to escalate a condition. Okay, so SBAR is used a lot in UK hospitals. So S is for situation, B is for background, A is for assessment, and R is about recommendations you make. Okay, so how do we make these notes now? Okay, so before we hand over, so we are going to make notes based on the information which test centers has given us under these 4 domains. Okay, so we're going to look at that now. So let's look at situation, which is on your screen now. So what do we add under situation? Okay, when we verbally hand over, what do we want to say in situation, and what notes should we add now? So like I said, in this station you will already have the paperwork back from your planning station, from your implementation, which is your mark chart, will be given back to you, and also your care plans will be given back to you. So you have all the information from last 3 stations to summarize in this one. So in situation we are going to say who you are. So my name is this, I'm a staff nurse on this ward. Okay, so you need to say the name and the clinical setting. Then you're going to introduce your patient. So you know what is your patient name, what is their hospital number, date of birth, and your patient location, where is your patient based on in the hospital. And if you then know the reason why you want to hand over or escalate a clinical condition, then you should quickly say that here, that you're worried your patient clinical condition is deteriorating. Okay, so that's what you need to add under S. Small information but very clearly. So okay, we're now going to move on into the main part of the handover, which is the background now. So background on your next screen is all about the background of your patient. So in here, you need to tell the date of admission, patient presenting symptoms, diagnosis, and also referral to any specialist team, which is going to be looking after the patient to manage their clinical conditions. So if you have made any specialist referrals about this patient, then you should add them in here. Now, where would you find this information? You will find it from your admission form and also some information from your care plans here. Okay, so the next thing we're going to add in here is your patient previous medical history, surgical history. So where would you find that? On your admission paperwork. And also, medication. So what your patient medication is at the moment. So that will be on your MAR chart. So you're going to add that from there. So in here. Okay, so all that should be in here. And then you also need to add their social history or their family history, which is again from your admission paperwork. You should add that in here. And the next thing you're going to say is give details of the findings from the assessment. So when you did their assessment in assessment station, if you found anything, so you will add the vitals from your assessment station in here. And then you also comment on your A to E assessment. If there was anything wrong with A to E assessment in your assessment station, then you should add that in here. Okay, so that's all about your patient background and their condition under B. So now we're going to move on to assessment, another big part of the handover in here. So here you're going to add your patient's current vitals, which they have given you on the evaluation template, which I have shown you earlier. So it's really important that you make note of those, and then you're going to add that in here. And then you're going to compare these vitals with patient previous vitals in assessment and highlight any changes. Okay, so any changes in the vitals, any changes in their clinical condition. So that should be added in here. And the next thing you're going to add in here is the nursing needs from your care plans and your nursing and medical interventions again from your care plans. And then you're going to clearly say what is your area of concern, because by now you would have figured it out from your new information in evaluation and what the information you had in assessment, what is happening with your patient. You may think they're developing sepsis. You may think if it's a post-op patient, are they developing any wound infection? If it's a patient come back from surgery, are they bleeding? Are they going into hypovolemic shock? What is the concern here? Okay, it will depend on what scenario you have in your exam. So you will be able to think little bit, just a very quick thinking that what you think is wrong with your patient. And then we're going to move on to recommendation. Here we're going to tell this doctor clearly what do you recommend. What do you want this doctor to do? I want doctor to do full assessment of my patient clinical condition at present, because I'm worried that my patient is deteriorating. So my main aim is that I want to make sure my patient gets the correct treatment as soon as possible. Okay, so that's what we want for the patient, is the correct treatment of their clinical condition now. Okay, and what's the concern. So that's what we're going to put in recommendation. So that just is the overview how you need to run the station. Now let's look at my top tips. My top tip will be use your time wisely. You got 8 minutes. So you can use 4 minutes to make clear notes. Like I said, clear notes are really, really important. You will not be able to hand over your patient without clear notes. So take time to make clear notes. You can use abbreviation, shorthand, but still, put all the information in and then use that time wisely and leave yourself at least 4 minutes to hand over. And the next top tip is make sure the information you put in matches the marking criteria. So you really do need to revise the marking criteria set by the test centers, because you don't want to put too much information from your previous paperwork, but you do want to add all the essential things they're asking from your previous stations. So it's absolutely important that you revise your marking criteria. And my third top tip is, even though your notes are now marked, make sure you are able to read your own handwriting, because when we're rushing, we may not be able to write clearly, but you need to write clearly because you need to be able to read that as a verbal handover to your patient. And the now most important tip for this station is the clarity of your verbal handover. Okay, so make sure your speech is clear, make sure you look confident, and make sure you use the systematic approach of SBAR in that order to hand over your patient to your assessor, which is acting up as a doctor. Okay, so these are my four main tips for this station. Hope you like this video and found it useful. Please press the like button now, and also don't forget to subscribe because it keeps me motivated to make some more videos for you about your OSCE exam. And visit us on oscenustraining.com, and I will soon be back with another useful video for you for your OSCE exam. So bye for now.